Some of you may remember David, the little boy in the bubble. He was a constituent from Shenandoah, Texas, who passed away at the age of 12 after living many years of his life in a sterile environment at the Texas Children's Hospital in Houston, Texas. His mom, Carol Ann DeMeritt, is a champion for David and for other patients who were born with an immunodeficiency disease. Carol Ann is a friend and a constituent and has worked so hard to help those patients impacted with that disease. For years now, Carol Ann and I and many others have been fighting to change a law that could help patients like David. Intravenous immune globulin, or IVIG therapy, is a vital step for treating patients with certain life-threatening diseases. These are patients for whom virtually every trip outside is potentially deadly. For the 250,000 Americans with primary immune deficiency disease, there's no place more dangerous than going to a hospital for treatment. This is why home IVIG treatment actually prevents people being exposed to common illnesses that may make you and I miserable for a day or two, but could be deadly for patients with suppressed immune systems. Regular access to IVIG therapy means a better quality of life, less disability, and potentially the difference between life and death. Unfortunately, today, current law excludes from Medicare coverage the items and the services necessary to administer this IVIG therapy in the home, where doctors tell us patients with compromised immune systems can benefit the most. The Medicare IVIG Access Act today requires the Centers for Medicare and Medicaid Services to do a couple things. Establishes a 3-year demonstration project to cover these items and services necessary to do this therapy in the home, evaluates the impact of the demonstration project on access for these Medicare beneficiaries, analyzes the appropriateness of implementing a new methodology for IVIG payment in all care settings under Medicare Part B, and updates a previous report on this by the Assistant Secretary for Planning and Evaluation. It's my intent that the required study consider the impact of lag times with respect to data used to determine the average sales price and recommendations to reduce the lag time to ensure more accurate pricing for IVIG, and to report whether home infusion saves the Medicare program tax dollars by improving access to all care settings. The Medicare Payment Advisory Committee recently looked at home infusion, including the access problem for Medicare beneficiaries with PIDD. And the June MedPAC report reported that a target expansion of home infusion coverage focusing on certain drugs would have more likelihood of savings. Drugs with a narrow indication, precise diagnostic criteria like IVIG for PID are less likely to have a woodwork effect than drugs with broad uses or imprecise diagnostic criteria. MedPAC's report also highlighted that fixing the Part B home infusion therapy or benefit for beneficiaries may save money because some of the other covered therapies for these patients are more expensive. I expect, Madam Speaker, the study required by this bill will give us more information about potential savings from giving people access to the right kind of care, reducing their exposure to germs and other settings, and increase compliance with the prescribed therapy. There may be a lot of division, partisanship in Washington right now, but not about this bill. I'd like to thank my esteemed colleague, Representative Doris Matsui of California, for her leadership and just tremendous hard work on this important bill. We have here today a solid bipartisan bill, and both the House and Senate joined together in support of Medicare IVIG access. And at this point, I would reserve the balance of my time.
Gentleman reserves balance of his time. Gentleman from Wisconsin.
Thank you, Madam Speaker. I yield myself such time as I may consume.
Gentleman's recognized.
Madam Speaker, I rise in strong support of H.R. 1845. It's a combination of two strong bipartisan common sense bills before the House today. I want to thank my gentleman on the Ways and Means Committee for his support of this important legislation. And as one of the co-authors of the SMART Act, one of the bills that have been combined today with Representative Tim Murphy, and an original co-sponsor of the Medicare IVIG Access Act, I'm glad these two bipartisan bills have been combined and brought to the floor for consideration and hopefully passage later today. The SMART Act had 139 bipartisan co-sponsors. The Medicare IVIG Access Act, with 65 bipartisan co-sponsors, are perfect examples of, at times, Democrats and Republicans joining forces and getting something done around this place. And hopefully that spirit will continue in the days to come with the difficult decisions that face this body. I'd like to thank my good friend Tim Murphy for his leadership and hard work in moving the SMART Act through the Energy and Commerce Committee. I'd also like to recognize the extraordinary broad stakeholder coalition that has worked so hard to help get the SMART Act on the floor today, particularly the American Association for Justice and the MARC Coalition. Finally, I want to thank Representative Brady and Doris Matsui for their tireless efforts on behalf of the Medicare IVIG Access Act. Their legislation is a step toward ensuring all seniors with primary immunodeficiency diseases are able to access life-saving IVIG drugs in their own home. But let me just take a few moments to discuss the need for the SMART Act. The SMART Act reforms the badly broken Medicare secondary payment system. For background, the Medicare secondary payment system requires Medicare to recoup the cost of hospital and doctor bills for a senior if her injuries are the responsibility of a private insurer or some other third party. So far, so good. Making sure Medicare doesn't pay for injuries caused by another third party is good policy to help keep Medicare solvent. The problem is that under the current system, seniors and parties that want to settle a claim often cannot determine how much they owe Medicare. That often results in the settlements to collapse. The result is that seniors are denied settlements to compensate for their injuries. The Medicare Trust Fund is never reimbursed. That's bad for seniors. It's bad for the Medicare program. We're talking about cases where seniors are trying to give money back to the government, and the government simply won't say how much they owe it. It's outrageous that seniors can't even give money back to Medicare that the government is owed because the system is broken down. At a time when Congress is considering cuts to the Medicare benefits and provider payments, we need to at least make sure Medicare is getting the money seniors want to send it. The SMART Act will improve the Medicare secondary payment system by making the government work more efficiently, reducing unnecessary burdens and waste, speeding the repayment of amounts owed to the Medicare Trust Fund. Now, the best way to demonstrate the need for the legislation is with a few examples of the current system's unfairness and outright absurdity. I have a handful of demand letters here sent by CMS to seniors asking to be repaid $1.59, or $2.81, or $4.82, or even $36.75. Those amounts CMS has sought to recoup from seniors is far less than the amount it actually costs CMS to pursue these claims. That's penny wise and a pound foolish. The SMART Act makes sure CMS is only pursuing Medicare secondary payment claims that will recoup at least the cost that it takes CMS to pursue these claims. That's common sense reform. This bill makes financial sense for Medicare, but it will also make a meaningful difference for seniors who are awaiting settlements that are held up by the Medicare's process today. In fact, I heard the story of one gentleman who fell on a retailer's handicap ramp while using a walker. Now, Mr. Law cut his left hand. He hit his head on the fence alongside the ramp. He and the retailer discussed the medical charges, and they agreed to settle for $2,000. It took 18 months and 8 written exchanges with CMS to resolve this simple MSP claim, which delayed settlement claim by the same 18 months. Plus, Mr. Law actually passed away during the extended time frame. We can do better for seniors. We can get Medicare the money it's owed a lot faster. This legislation would accomplish that. These are just a few of the examples of why the SMART Act is needed. The toll this broken system takes on seniors and the burden it imposes on businesses is unacceptable. I urge my colleagues to vote for H.R. 1845 to support this common sense reform, including the IVIG program. And Madam Speaker, since this may be the last time I'll have a chance to address you and the Chair, I too want to echo the sentiments of so many of our colleagues to congratulate you on such a distinguished career here in the House. You did well in representing your constituents back home in Missouri. We'll miss you as a colleague, someone who tried hard to work in finding bipartisan common sense solutions to the challenges facing our nation. And of course, we wish you all the best in your future endeavors. I'll reserve the balance of my time.
Gentleman reserves the balance of his time. Gentleman from Texas.
Madam Speaker, I'd ask unanimous consent to include in the record an exchange of letters between the Ways and Means Committee and Energy and Commerce related to this bill.
Without objection.
This time, I would yield 2 minutes to the chairman of the Health Subcommittee, a longtime fighter for patients and those on Medicare, the gentleman from California, Mr. Herger.
Gentleman from California is recognized for 2 minutes.
I thank my friend from Texas. Madam Speaker, I rise today in strong support of H.R. 1845 as amended, the Medicare IVIG Access and Strengthening Medicare and Repaying Taxpayers Act of 2012. This legislation would create a 3-year demonstration project to provide up to 4,000 Medicare beneficiaries suffering from primary immunodeficiency diseases with in-home coverage of IVIG. Medicare beneficiaries with PID need the biologic IVIG to boost their immune system so they can fight off infection and maintain a high quality of life. Medicare currently offers comprehensive coverage of IVIG treatments in the physician office and hospital setting, but not when IVIG is administered in the home. This flawed payment policy encourages Medicare beneficiaries to receive care in the most costly settings. Under this demonstration project, Medicare Part B would cover the home administration costs, including the trained medical professional who administers the biologic, allowing up to 4,000 beneficiaries with PID to receive IVIG treatments in their home. Importantly, beneficiaries who receive IVIG in their home can avoid the risk of infection inherent in alternative treatment settings. The HHS Secretary would be required to issue a report to Congress detailing the impact this demonstration project had on beneficiary access to care and whether or not CMS should permanently change its IVIG coverage policy. According to CBO, the costs of this one-time demonstration are fully offset by permanently reforming Medicare's secondary payer rules as detailed in the SMART Act. The SMART Act will help ensure that taxpayers will not be stuck with a Medicare bill for incidents caused when another party is liable or negligent. The SMART Act also makes important changes so that the arcane Medicare rules would no longer be an impediment to parties resolving their indifferences and reaching settlement.
I'd like to extend another minute from
Thank
California.
you.
Madam Speaker, we need to protect the Medicare trust funds, and we need to have an efficient, consistent, and clear process to resolve these claims. And the SMART Act does exactly that. I urge my colleagues to join me in support of this important legislation. I yield back the remainder of my time.
Gentleman yields back. Gentleman from Wisconsin.
Thank you, Madam Speaker. And Madam Speaker, I want to thank my good friend, the gentleman from California, for his support of 1845, in particular the SMART Act, and congratulate him as well on his distinguished career, since he will be retiring at the end of this session of Congress as well. But at this time, I'd like to recognize the gentlelady from California and the principal author of the Medicare IVIG Act, Ms. Matsui, such time as she may consume.
Gentlewoman from California is recognized.
I'd like to thank my colleague for yielding, and I also want to say, Madam Speaker, thank you for your many wonderful years of service and our friendship. We'll miss you in this chamber, and we wish you well.
Thank you.
Madam Speaker, I rise in strong support of H.R. 1845, the Medicare IVIG Access Act. I'd like to thank Congressman Brady for his hard work and his leadership in this legislation, as well as Congressman Kind for the leadership on the SMART Act provisions of this important legislation. Primary immune deficiency diseases, or as we call it, PIDD, is a group of diseases that cause a person's immune system to be unable to function properly. Unlike most of us who are able to fight common infectious diseases, patients with untreated PIDD can become seriously ill from a simple cold virus or even a cut on their arm. Patients with PIDD are generally treated with intravenous immunoglobulin, or IVIG, a complex drug that provides them a temporary immune system. Every 3 to 4 weeks, patients receive an IV treatment for about 2 to 4 weeks per treatment, 2 to 4 hours rather per treatment. To maintain a healthy immune system, they must have this treatment for the rest of their lives. People with commercial insurance typically receive care in any of 3 settings: hospital outpatient department, a physician's office, or at home, administrated by a nurse. For many patients, receiving their care at home is optimal, as it greatly reduces the risk of infection. However, the Medicare beneficiaries with PIDD, the program pays for home infusion of IVIG, but does not cover the nursing services and supplies. As you can imagine, a 74-year-old Medicare recipient on a fixed income is not capable of paying the several $100s a month necessary for the nurse to provide IVIG infusions in their homes. As a result, many patients are forced to receive their treatment in a hospital setting, oftentimes increasing the likelihood of infection, pneumonia, and expensive stay in a hospital billed to Medicare. Madam Speaker, this does not make sense for the patient or for Medicare. And that's why Congressman Brady and I introduced the Medicare IVIG Access Act. Madam Speaker, this legislation is budget neutral and fully paid for. H.R. 1845 creates a 3-year demonstration project capped at 4,000 patients, in which the nursing services and supplies associated with home infusion of IVIG will be covered for Medicare beneficiaries with PIDD. I believe that this project will mirror the results of studies of patients with commercial insurance that found increased compliance, fewer infections, and overall savings for patients infused at home versus the hospital. Madam Speaker, patients with rare genetic diseases should not see their access to care diminish when they become eligible for Medicare. H.R. 1845 fixes the gap in Medicare coverage that unfairly restricts patients' access to IVIG and disrupts their continuity of care. I strongly encourage my colleagues to vote for this critically important legislation, and I yield back the balance of my time.
It's for time. Gentleman from Texas.
Madam Speaker, I'm pleased to yield 5 minutes to the lead author, champion of the SMART Act, and one of our healthcare leaders, Mr. Murphy, Pennsylvania.
Gentleman from Pennsylvania is recognized for 5 minutes.
I thank the gentleman, and Madam Speaker, may I add my accolades to your work for the people of Missouri, particularly my ancestors who founded Murphy's Settlement, now Farmington, your district. You've done them well. 4 years ago, Lorraine Babbage of Washington County, Pennsylvania, then age 73, suffered injuries so severe from a car accident that she will never fully recover. After the accident, Lorraine underwent a very difficult surgery. She was transferred to a rehabilitation facility where she contracted methicillin-resistant Staphylococcus aureus, otherwise known as MRSA. Sadly, Lorraine's condition has worsened, and she now suffers from dementia and must receive 24/7 care at a nursing home. The physical pain in Lorraine's life is multiplied by the emotional pain of recent years. A year after the accident, Lorraine lost her husband. Then last year, her only child passed away. Lorraine's story is heartbreaking and tragic, and it's depressing to learn Medicare is working against Lorraine's interests. In the fall of 2010, Lorraine's family and the automobile insurer for the other driver in the accident reached a monetary settlement. The insurer agreed to pay Lorraine's medical bills, and Lorraine would also collect damages. First, Lorraine's health insurer, Medicare, had to be repaid. But the Centers for Medicare and Medicaid Services won't tell Lorraine or the auto insurer how much is owed to the Medicare Trust Fund. The insurance company wants to reimburse Medicare and provide Lorraine with a settlement, but CMS's complicated bureaucracy is standing in the way. Now, there are thousands of cases just like Lorraine in the congressional districts across the country, but we now have a chance to fix this problem and make sure Lorraine and her family receive what they are rightfully owed by passing H.R. 1845, which includes a bipartisan bill I introduced with my friend Congressman Ron Kind. Our bill, the Strengthening Medicare and Repaying Taxpayers Act, or the SMART Act, will recoup billions of dollars owed by insurance companies to the Medicare Trust Fund
quickly and eliminate waste within CMS. The SMART Act, which has nearly 140 bipartisan co-sponsors and the support of trial lawyers, patient advocates, defense attorneys, and the U.S. Chamber of Commerce, requires that Medicare provide settling parties with accurate information about the total costs of medical bills when the parties announce a settlement is near. The Congressional Budget Office has looked at our bill and found it will save millions in overhead costs at Medicare. The current Medicare secondary payer bureaucracy is causing seniors to have their Social Security checks garnished and their Medicare coverage denied through no fault of their own. Our bill fixes these issues, and it ensures bureaucracy does not stand in the way of a settlement. Right now, insurers are walking away from settlements because of the flaws of the Medicare secondary payer statute. And when those settlements break down, seniors get nothing, and the taxpayers are not repaid. By enacting this legislation, Congress can help Lorraine and thousands of senior citizens who are needlessly suffering because Medicare isn't operating effectively and efficiently. I want to thank Chairman Upton and Camp, Ranking Members Waxman and Levin, and Congressman Kine for their support in this legislation. I want to extend a special thanks to their respective staffs for their hard work, particularly Robert Horn and DeBrad Grants. Without them, this legislation wouldn't be moving forward. This is good government. This saves taxpayers money. I urge its adoption, and I yield back.
Gentleman yields back. Gentleman from from Wisconsin. The chair needs new contact lenses.
This time I'd like to yield to my very good friend, the gentleman of New Jersey and one of the leaders of the Energy and Commerce Committee, Mr. Pallone, such time as he may consume.
Gentleman from New Jersey is recognized for such time as he may consume.
Thank you, Madam Speaker, and I want to thank the gentleman from Wisconsin. Madam Speaker, I rise to lend my support to H.R. 1845 as amended. This bill combines two pieces of legislation, H.R. 1845, which provides a demonstration for the coverage of home infusion of intravenous immune globulin, or IVIG, and H.R. 1063, which makes improvements to the Medicare secondary payer process, or MSP. However, I would like to note my concerns about the process. Our committee acted on H.R. 1063, and I commend the chairman for his efforts to ensure it was a bipartisan product. But we did not act on the IVIG legislation, which is every bit as important to our members as the MSP. So it's my hope that in the future we can avoid situations like this. The Medicare secondary payer provisions of this bill will reduce the burdens of the secondary payer process for beneficiaries and other stakeholders. Most importantly, the legislation will do so in a way that ensures that we're also protecting taxpayer dollars and the Medicare Trust Fund. I do worry, however, that the MSP bill does not include administrative funding for the Centers for Medicare and Medicaid Services, or CMS, to implement these new changes. One of the primary complaints I hear about MSP is that stakeholders are currently frustrated because the process does not move fast enough. But here we are legislating new responsibilities for CMS on top of an already slow process with no new funding. This will simply burden the agency and make it more difficult to get to resolution on secondary payer cases in a timely fashion. So I hope that at some future date we can provide a reasonable sum to the agency to allow them to be better equipped to speed this process along. One additional point on MSP. The new process we've established for resolving disputes of claims posted on the web portal is not intended to supplant the ordinary appeals process for MSP activities. I believe that is clear in the language, but I want to note that there should be no ambiguity. This bill does not supplant existing appeals rights. In addition to MSP changes, this bill also provides for a 3-year demonstration related to IVIG. IVIG is a blood-derived treatment that helps strengthen the immune systems of immune-deficient patients and prevents paralysis in some autoimmune diseases and neuropathies. Currently, Medicare beneficiaries may receive home infusion of IVIG as a Part B benefit. However, the equipment, nursing services, and supplies necessary for the home infusion are not reimbursed. Now, Congressman Matsui has been a clear leader on this issue, and it's to her credit that it's included in this package today. She's worked so tirelessly on this IVIG issue, and I'm hopeful that this demonstration project she has championed will both save money for the Medicare program and improve access to needed services for this vulnerable population, and I thank her for her leadership on behalf of these patients. I also want to thank Chairman Upton for working on these two issues with us, and I look forward to the next Congress where hopefully we'll find additional areas of common ground to work on. So thank you, Madam Speaker, and I reserve the balance of
Gentleman reserves the balance of his time. Gentleman from Texas.
Madam Speaker, if there are no other speakers at this time,
I'll support H.R. 1845, and I'll yield back at this time.
Gentleman from
Give my
Wisconsin
friend a chance
yields
to close.
back.
well, in closing, I yield myself as much time as I may consume.
Gentleman from
But in
Texas.
closing, I want to thank my counterpart, Doris Matsui, for great work on this issue, and I so appreciate the leadership and partnership of Mr. Kind and Mr. Murphy in combining these two important health care bills in order to both provide safer, more affordable access to care for those with compromised immune deficiencies, as well as finding ways to save money with the important Medicare program and the SMART Act. I want to thank Dan Elling, Staff Director of the Ways and Means Subcommittee on Health, as well as Jennifer Safarian for her leadership of Ways and Means Committee. But I especially want to thank my constituent friend, Caroline DeMeritt, the mom of David, for her decades of hard work on behalf of these patients. And I appreciate so much Marcia Boyle, the founder of the Immunodeficiency Foundation, all those patients who for years have come up here asking for this help and change. Today, this Congress, Republicans and Democrats alike, join together in providing that help and that access. I urge support for this bill and yield back.
Gentleman yields back. The question is, will the House suspend the rules and pass the bill H.R. 1845 as amended? Those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended. From Texas. The yeas and nays are requested. All those in favor of taking the vote by the yeas and nays will rise and remain standing until counted.